An interesting study was done in California not too long ago, where some researchers decided, let us see now this personal recovery concept has been going on for some time now. The federal government has published frameworks, policy papers saying all mental health services need to focus on achieving personal recovery for their consumers, for their patients. So these guys decided to study whether that actually works. This is in California, mind you. And see, this is what they concluded. Utilization of mental health services was associated with lower levels of personal recovery, which may indicate that care, as typically utilized and received, does not promote personal recovery. Excuse me, what are you doing? You know? But this is the reality. Nobody wants to read this. Nobody likes this paper at all. They don't want to, they don't even know about it. Which what? Which person? No, we don't know. That's so if you don't know, then you nobody can find fault with you. That's where Happy Chat comes into play. So what did Happy Chat do actually? They provided a welcoming, non-judgmental kind of atmosphere, sharing a meal, a chat. They were inclusive. They provided a safe space, gave human connections for people, connectedness. That's why I said that right at the top. Building hope through kindness, social and emotional support, general support. Life admin, my goodness, I love that term, life admin. It is so, it just encompasses everything, isn't it? You don't need, I mean, my wife told me about life admin a few years ago. She just dropped it. She said, excuse me, I have to take care of life admin in this house. I said, oh, sorry, come again? What did you say? She said, oh, you wouldn't know, would you? You were busy with your work, but looking after the home. So then I slowly, when she was in a better mood, I discussed about life admin with her, got to understand what it was all about. And I realized you don't need to have mental health problems to need life admin support. If you have mental health problems, you need a lot more life admin support,
Yeah.
helping each other, enabling agency, helping people to make decisions by themselves. No, not saying, no, you don't know anything. I will tell you what to do. No, not like that. I will help you to decide. You can take the decision by yourself, but I will help you to make that decision. Enabling agency, monitoring well-being. Jim's not looking too good today. We should keep an eye on him. Jim can't do that by himself. He needs support. He needs people to look at him. Mental health services are not going to do that. Because if you're within the mental health services, you're really unwell. But this is Jim walking on the street. Who's there to help him other than people like Happy Chat and support groups? So that is why it's so important. If he goes into crisis, there is people to help him with their crisis care and support. Advocacy. If Jim needs somebody there to help him to find that. Continuing connections. This is brilliant. This is something I learned only after I evaluated Happy Chat. There are people who came to Happy Chat, finished and moved on, but come back, drive 2 hours back to Happy Chat to spend time with their friends, the people who they've befriended over the course of their time with Happy Chat. Continuing connections. It resonates with me because my children are 18 and 20 now. They're about to leave home. My wife is going crazy. But we console each other, telling ourselves that, they will come back because they have to come back home, Continuing connection. They're not just going to leave and then disappear into the horizon. They're going to keep coming back home. My son said, Mom, I'm going to come back home because I've got lots of laundry to do. So at least for that purpose, I'm going to come home. Continuing connection. So what Happy Chat has done is develop strong bonds. One of the respondents said, I've got my tribe now. I've got my family now. I mean, this is basic human needs. It's not something extraordinary. And that is what I'm trying to show and demonstrate to the clinical community, that this is an unmet need which needs to be fulfilled. Continuing support. So it's not a one-off thing. It's not you just come to the service, get your support, and then push off. No, it's continuing. It's establishing a support system that is going to stay with you over time. So what did they achieve? Happy Chat did all this. So what did they achieve? Motivation to leave the house. There is something outside my house that makes me happy, that makes me feel wanted, that makes me confident, that gives me a sense of belonging. That's a place of comfort. I want to go. I want to leave my house. How many people are in that state who do not have this motivation to leave the house? Very important. It's safe to be me. I don't need to try to be somebody else. I can just be myself. And because of that, because I have confidence, I improve. My health has improved. My well-being has improved. I take care of myself a lot more. One member told me, "Oh, I go for long walks. I walk 5 kilometers a day. I couldn't walk even 10 meters before that, and that's what Happy Chat has done. It's given me confidence to take care of myself. I do exercise now. I go to the gym. Improved social life and social skills. I can speak to the lady in the supermarket. I still have a bit of trepidation and anxiety, but I can overcome that. Previously, I couldn't, and I wouldn't speak to any stranger, but now I can. I have that. I'm aware of it, but I can still speak to them. And that improves my quality of life. It improves my social skills, improves my social life. Because all these interactions keep raising your capabilities, your abilities to socially interact, a new identity. I'm no longer confined to, oh, my mental illness. No, I can hold my head high. A new sense of purpose, a new sense of hope. I hope you can recognize where this is going and how this relates to my first slide of the CHIME framework of what people are looking forward to in personal recovery. Employment. One gentleman came, spent time with Happy Chat, felt much better, and then got a job. Which mental health service will do that? And then finally, realization that it is the system that has failed and not us. You know, uh, in clinical psychiatry, the whole it's not a strengths-based approach. Generally, medicine is not a strengths-based approach, but we need a strengths-based approach. And that's what Happy Chat achieved. Now, did Happy Chat contribute to personal recovery? So what I did here was I listed the supports on one side and I matched them with the CHIME framework. And we asked people from Happy Chat and some of my colleagues who are people with lived experience to actually tell us, what do they think? Does it match? And you see, most of the cells have got tick marks in. Some of them have double ticks. That means it's strongly linked to personal recovery. If you had mental health service on the right, on the left side, all these cells would be blank. At least most of them would be blank. This clearly shows that Happy Chat and support groups definitely help people to achieve personal recovery. Now, these are the outcomes. Again, look at most of the cells have got tick marks in them, which means they are associated with personal recovery. So, what's the way forward? For mental health services, if a mental health service cannot address the non-medical needs of persons with severe mental health challenges, they need to work collaboratively with those who do. Those with the like Happy Chat, they need to work collaboratively. But unfortunately, clinicians work in a very, very regimented system that is not easily changed unless it happens from inside. And I am trying to do that as a physician because I understand medicine, because I'm a doctor. They understand me. They feel comfortable with me because I speak their language. And because I'm a public health physician and I have set up mental health services in other countries before, but basically in India, I work a lot with non-medical people who know very little about medicine. So I can speak to both teams, both groups. So what I'm trying to do is slowly bring them together to work together. I don't know whether I'll succeed during my lifetime, but I'm trying. I promise you I'm trying. It's a slow process, but I'm trying. So what's the way forward for peer-led groups like Happy Chat? The work you do is incredibly important. it makes a significant difference to people's lives. How? Because you keep them out of hospital. One of the main issues faced by people with severe mental health challenges is psychological distress. Why are they distressed? Because all these other things are not taken care of, and they get distressed, the symptoms get worse, they end up in emergency, they end up in hospital. By looking after this life admin, you're keeping them out of hospital. So the funders are happy because you're reducing costs of care for people with severe mental illness. You're keeping them out of emergency department. I mean, nobody wants to go to the emergency department. Even if whatever problem you have, you do not want to go to the emergency department because you'll get more sick. Because you have to wait for so long, and then they have this triage system. I am not a fan. I'm personally not a fan. You're reducing risk of suicide and self-harm. This actually, respondents told me. I wouldn't be here if it were not for Happy Chat. I would have already succeeded in taking my life. One respondent actually told me that. So you are reducing the risk of suicide and self-harm. All this is music to the ears of mental health case managers. It is music because this is what they're trying to do, but they can't. Because they are overwhelmed with work. They don't have time to do all this kind of stuff. You improve well-being of people. You're promoting personal recovery in people. So the government will be thrilled when they hear that your work is personal recovery oriented. But most importantly, your work is nowhere as expensive as a clinical service. That is your USP, your unique selling proposition. And you need to focus on that. First, you need to show that you're making a difference. Then you need to highlight that it's not expensive, But the challenge is to gain visibility to mental health services and to government. That show them that you're actually filling a gap in care for people with severe mental health challenges. So the way to do that, first, keep doing what you're doing because you're doing a brilliant job. Second, demonstrate effectiveness of what you're doing. Get your services formally evaluated and published. Then you can take that report and show it to people. See what we are doing. This is the difference we are making. If it's done objectively, then people have to take notice. Showcase your work. Go and present at conference presentations for mental health. Themes Conference, I feel, is a very good conference in Australia. It's called the Mental Health Services Conference. They give bursaries for people with lived experience and for support groups, so you don't have to pay much. You can just go there and talk about the work that you're doing, and they'll be very appreciative. Put it on social media. Show people what you're doing. People need to see. There's no point in doing great work and not show it. When I was studying, one of my professors told me research that is not published is research that is not done. If nobody knows what you have done, that means you have not done it. There's no point in you having spent lots of time doing work when nobody knows. People need to know. You need to show them. Political advocacy. Take your reports, show it to your local MPs and see the difference that we are making. We're struggling. We don't have much money. We need help. And then mental health services. You can use advertisements. You can use flyers. You can keep it there in mental health services. Clients might pick it up and say, I'll give this a try, because many of them have come to Happy Chat because of word of mouth. People have told them, why don't you go to Happy Chat? And they're the best decisions they have ever made. So advertise. I also want to caution, when I asked one of the participants about more funding, because Happy Chat does not have funding, he got a bit, he said, oh, well, Anton, I don't know about that. I said, why? What do you mean? He said, I worry that once money starts coming in, we will no longer be the priority. The great thing about support groups and what you're doing is because it's not directed by money. It is directed out of passion, out of love, out of care for people who need help. What this man was telling me is that he's fearful of losing this tribe, losing this family if money comes in, because now he knows he has a family, he has a tribe. He does not want to lose it because that's all he has. You see? So we need to constantly remember not to lose focus of where we're coming from. Do you follow what I'm saying?
Mm.
So what recommendations for funding bodies? Where funding bodies need to fund proper evaluations of peer-led groups. You already mentioned that you've got interest from researchers from universities because they realize that it is people like you who are actually going to make a difference on the ground. And in 10, 15 years' time, support groups will become a key. I mean, you can rest assured that support groups will become a key part of service delivery in the world. You are already showing the way. You're showing the way. It is just a matter of time before people realize, they sit back and take notice and say, no, this is an important component of our service delivery of care. Because without these groups, our patients, our consumers are not going to get everything that they need because you're filling a gap that is existing. You're addressing unmet needs of individuals. But when you plan evaluations, plan in advance, give it at least 2 years because you've got to follow up patients. One of the things that funders and politicians and big psychiatrists tell me is, oh, you're doing this qualitative work. It's all very, very nice and happy. People are, they're happy with what they're given. But show me objective research. What they mean is show me the numbers. So to get numbers, see, in mental health, it's not like a blood test. You can't do a blood test and show personal recovery. You have to use measures. Mental health services use measures like the Kessler 10 questionnaire and all that. So there are measures of personal recovery which you can administer to your people who come in at it when they come in for the first time, and then measure it over time and measure when they finish or the end of 2 years and show clearly that there's a change. And we are responsible for that change. And that's the change that the government wants to see. That's the change that the mental health services want to see, but they cannot, whereas you can. So I would encourage you to focus on showcasing objectively the difference that you are making and work with researchers who will be able to help you to do that and publish it. And include mixed methods, both qualitative and quantitative. So the numbers as well as the words.